Hello everyone, today we are going to talk about angina pectoris. Do you or one of your parents suffer from chronic diseases such as pressure, diabetes, and high fat level? Did either of your parents feel a sharp pain in the chest with shortness of breath and sweating, which quickly disappeared when he relieved himself from the effort he was making? Well, it might be the symptoms of angina pectoris, a disease of the coronary artery of the heart. In this video, we will explain to you everything related to angina, what it is, risk factors for its occurrence, symptoms, and how to diagnose and treat it. Our role today is to answer most of your questions regarding angina pectoris. Today we have Dr. Lim, who is the leading doctor at Hanyang University Hospital. He's going to discuss with us everything about angina pectoris from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Okay, so that was the questions for hypertension. We'll move on to angina pectoris. So what is angina and angina pectoris? How does it occur?
Okay.
Angina refers to chest pain. Angina pectoris, here mean as chest pain, originated from the heart. It occurs when blood supply to the cardiac muscles are insufficient and when the myocardial oxygen and nutrient requirements is not met by the blood supply results in angina. What I'm saying is that when vessels are normal, blood flow is adequate, but when I climb the stairs or go jogging, the heart would beat faster, and when the heartbeat increases, myocardial oxygen and nutrient demand increases in tandem. But when the pathway for those oxygen and nutrients, which would be the vessels, become narrow, it would be okay in normal circumstances, but when it is narrow, it will cause pain. For instance, when you are running, because there isn't enough blood flow, and since the heart can't speak for itself, it will present itself as pain. And what happens when we feel pain? We take a break. When we rest, the heartbeat lowers and the symptoms disappear. Fundamentally, the narrowing or stenosis of vessels means that the vessels are aging and become sclerotic. When the heart demands sufficient energy and the body cannot supply it, we call this angina.
So it has any symptoms? Like getting tired?
Most people complain of chest pain, while some complain of nausea, indigestion. Still, others say they feel tired or their left arm aches. There's a wide variety, the most common one being elusive chest tightness or discomfort that occurs during exertion.
Discomfort.
Yeah.
So what you talked about is similar symptoms to heart attack, right?
Yeah.
So how can you make a difference between it's an angina or a heart
Okay.
attack?
Angina, as I have explained, may present with symptoms under exertion and when you rest. There may be no symptoms in day-to-day life. But heart attacks, here refer to myocardial infarct, more specifically acute myocardial infarct. Myocardial infarcts cause extreme pain even when resting and last quite long if angina is not treated properly. In its initial state, it may progress to a heart attack. So angina can be seen as an initial symptom of heart attack, and if it's not addressed properly, it may lead to heart attack, and acute myocardial infarcts entail a high mortality. If you look at these statistics, out of 10 heart attacks that happen outside the hospital, 3 to 4 are fatal. That's quite serious.
So angina can develop into a heart attack is what you say. So how do you diagnose angina?
Angina can be mostly diagnosed through history, taking when the patients complain of certain discomforts, such as dyspnea on exertion, or any pain can be detected through history taking, and to support this, Korea has been increasingly using coronary CT angiograms. When symptoms present, CT angiograms allow us to see the arteries directly. In the past, exercise stress tests were commonly used, but nowadays the diagnostic tools are more direct, and the guidelines also suggest the use of these tools.
Okay. So is it same as hypertension where the treatment is also medication, or there are also other treatments?
There is a slight difference in treatment of the two diseases, although there are some antihypertensive medications that are also used against angina. Medications treating angina can be classified into those that widen the vessels, slow the pulse, and drugs that prevent clots.
So for surgery, what is bypass surgery and when do we perform it?
In the past, treatment for angina for narrowed arteries 20 years ago, the standard was bypass surgery. Today, stent surgery are performed more frequently than bypass surgery in Korea and in the world. We approach the narrow artery and broaden it with a stent. Although certain patients with either very severe angina or those who suffer from various other vascular pathologies do still go through bypass surgery. Angina treatment is quite complicated from medical treatment to the mentioned bypass surgery. There's a very wide spectrum when to perform stent surgery in addition to medical treatment. And if that doesn't cut it, even bypass surgery, it differs for each person as to what and when we choose it.
So, Professor, you talked about stent surgery.
Yeah.
Yes.
Yeah.
Can you talk a little bit more about coronary stent surgery, what it is?
I mainly perform stent surgeries, about 400 to 500 patients per year, which is about 40 per month. We refer to an institution as a big center when they perform over 400 cases a year, which includes us, and our results are also decent. The surgery has improved compared to the past both in techniques and drugs used, so stent surgeries belong to one of the simpler surgeries. Most patients are discharged within 3 days of admission.
Okay. So going back to angina, is it possible to live a normal life even if you have it?
Yeah.
Yes, even when you have angina and you receive treatment, such as coronary stent placement or taking drugs, your life is identical to that of a healthy person, but when a heart attack occurs or a heart failure, this can decrease the quality of life significantly.
So how do you prevent angina? Is it the same way that you prevent blood pressure?
Yes.
Same.
The only way to prevent angina is to control risk factors. Risk factors for hypertension, such as smoking or obesity, are all risk factors for angina. But more importantly, it occurs as a result of several other diseases. The first one is hypertension. Second, diabetes mellitus. And thirdly, dyslipidemia. It is important to find these illnesses prior and engage in any type of treatment. And to engage in regular physical activity to reduce weight is also important.
Today, the doctor explained in details everything related to angina pectoris, such as its symptoms and how can it be treated and prevented. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.